This was in the Wall Street Journal just a few days ago. Quote, the Department of Veterans Affairs is experiencing serious shortages of protective gear for its medical workers treating patients infected by coronavirus, according to excerpts of internal memos shared with the Wall Street Journal. A few days ago in the Journal, one of those memos was something that was circulated among a group of top-ranking VA officials. It said, quote, experiencing serious PPE shortages. Several sites doing 3D printing, but it is not enough. Soon, PPE will be rationed. Those are the kinds of alarm bells that were going off this month within the VA at the highest levels inside the department. To the public, though, the VA was taking a stance that was very different than that. On the same day that that internal memo circulated at the highest levels of the VA, warning about serious shortages and rationing of PPE, a spokeswoman for the department said publicly that there was no concern about any shortage of equipment. Quote, all VA facilities are equipped with essential items and supplies, and we're continually monitoring the status of those items to ensure a robust supply chain. Which sounds great. Good talk. The only problem is, right, internal memos showing exactly the opposite ground truth inside real VA medical facilities kept leaking out. After that initial report, the Journal soon got their hands on another internal VA memo that had again been sent to top level VA officials, saying that the rationing of PPE had officially begun. By which point VA workers on the front lines were already dealing with that reality. At one Kansas City facility, personnel were being given one mask per day. They were told to make it last unless it is, quote, irredeemably soiled. In the days since, the Journal has reported that the situation has deteriorated further. Quote, a shortage of face masks and N95 respirators has led the Department of Veterans Affairs to tell hospitals to decide which employees get masks and which don't. Again, according to internal memos reviewed by the Wall Street Journal. One of those memos said, quote, mask supply levels in the VA Health Administration do not support providing masks to all other employees. They also told hospital administrators that the department will allow staff to bring their own masks or respirators when hospitals don't have them available. Bring your own. See what you can cobble together from stuff you find around the house while you treat America's veterans at VA medical facilities. I will say that bring it from home anecdote tracks with information we received from one VA medical facility in Georgia, where staff were told the medical center was seeking donations from the public for basic things like disinfecting wipes, paper towels, and bleach, let alone gloves and face shields and masks. They're soliciting bleach donations from the public for a VA medical center? Despite all this evidence of what's actually happening inside VA facilities, the public line from the VA has continued to be, incredibly, that everything is just fine, there's nothing wrong at all. When the Wall Street Journal went to the VA for comment on the shortages and the rationing of masks, VA spokeswoman Christina Noel told the paper, quote, the premise of your question is false. All employees who need PPE have it. Doesn't seem like that's true. Why won't the VA admit it? The VA is trying to sort of happy talk the public about this, but there is a real crisis taking place. I mean, we've learned that as of today, more than 1,500 VA staff have tested positive for coronavirus. 13 staff members are already known to have died. There are more than 4,200 coronavirus cases among veterans within the VA system. 257 vets are already known to have died. And that's separate and apart from the situation in state-run veterans' homes, the ones that are run by various states. And in those facilities, we have seen deterioration at a rapid clip. Within the past day alone, we've seen reporting on an explosion of cases in state-run veterans' homes in Alabama, in New Jersey, in Maine, in Washington State, in North Carolina. In the worst case, which you have been hearing about over the last several days, 44 veteran residents have now died at just one veterans home in Holyoke, Massachusetts. 44, one facility. The Trump administration's Secretary of Veterans Affairs, Robert Wilkie, has been largely absent amid all of this. He has held no daily public briefings. He has done little to no press. We know from the Wall Street Journal's reporting that he is being briefed about equipment shortages, but he hasn't said anything about that in recent weeks. Problems at the VA are not a surprise. Lots of different health systems are having problems. But they're not going to get any better simply by avoiding answering questions about them and pretending everything's fine. They're not going to get better by happy talking the public and saying there are plenty of supplies when clearly there are not. The VA is the largest healthcare system in the entire country, run directly by the federal government, serving more than 9 million of our nation's veterans. Baghdad bobbing your way through this is not going to work. It's not even going to work as PR.